younger now. A little boy with ear infections. 8 sets of antibiotics by the time he was 12 months old.
Wow.
I mean, just literally destroying his immune system, and they were getting no help, getting ready to take him in. I mean, so they'll start the drugs at any age. And so we see these people coming in on multiple medications, damage to their nervous system. The little boy that came in with 8 ear infections in the 12 months, he'd been subluxated since birth.
Wow.
And the birth process is so traumatic, not only to the mother, but a lot of times to the baby.
Right.
And that damage occurred right from the birth process. So when they pulled him out, they damaged that upper neck bone, which is your atlas, putting pressure right on his brainstem.
Right.
So literally, if he would have came into our office, they had him scheduled in 2 weeks before he came into our office for surgery on his adenoids, his tonsils, and to put tubes in his ears.
Wow.
And we're noticing that, and we notice that seniors and even adults are on more medication than ever. The national average is 4 to 7 medications a day. Seniors are taking 14 to 17 medications.
Wow.
Senior last week walked in my office, 51 medications.
51?
51 medications.
Now, do you find that these medications are helping at all or making the person worse?
They're worse.
They're worse.
They're worse. Gentleman just came in.
And that's not you saying that. I mean, that's them. I mean, you asked them.
Oh, I asked them.
Yeah.
How are you doing?
Yeah.
I'm not getting any better. That's why they show up at our office.
Right.
They're looking for help. They know those drugs aren't getting them well.
Right.
And it's sad because they go back and they just get more drugs to cover more symptoms that those drugs are causing to have more symptoms.
Right, and they're essentially not even getting to the cause of why they're getting to that disease in the first place. Kind of like that patient that walked in with the liver problems, They were just trying to treat the symptoms, and again, we found that there was, severe nerve system dysfunction that was shutting down her liver. I mean, if you can remove that, no matter, what type of symptom it is, whether it be chronic fatigue syndrome, fibromyalgia, even nervous system problems like Parkinson's or multiple sclerosis, those are all directly related to the nerve system.
Oh,
so,
absolutely.
we see, all types of problems come in like that and get dramatic results with that. But, when you have a nerve system dysfunction, it's impossible for your body to work properly, right?
Oh, absolutely.
Yeah.
It can't work. It cannot work.
Right. It's impossible.
If you cut off the life flow from the brain down your spinal cord, and you cut that life flow off, just like Christopher Reeves did, it'll shut down everything. It shut down his legs,
right.
his
he
muscles.
fractured his C2, which is the second bone in his neck, right?
Correct, yeah.
Okay.
And when he fractured it, literally most people think it severed it.
Right.
But if you severed your spinal cord, what would happen immediately?
You'd be dead immediately.
Immediately. What he did is he crushed it by 1 centimeter. And when that crushed it, that cut off the information process from his brain down the spinal cord, out the nerves, and it shut down his heart, shut down his lungs, shut down the muscles in his legs. It literally shut down every function of his body.
He was tied up to, 2 or 3 different machines to help him breathe, to help his heart pump. Even his digestion shut down too.
Yeah.
And again, we're not talking about that type of severe crushing, but just a few millimeters and just shutting that nerve system down by, say, 5 or 10%, you're not going to feel it. There's no pain. Right?
Correct, right.
So, your nerves, say it was going to the heart, if that's getting shut down 5 or 10%, you're not going to feel it. But again, 10, 20 years down the road, you're going to start to develop heart disease, high blood pressure, high cholesterol, and eventually, when that nerve starts to shut down even more, eventually you're going to have what? A heart attack, and eventually
death.
Die, right? So, you need to find these problems before they get even larger. And you can actually see one of these diagrams that we brought with us today actually shows us what happens when you do have a nerve system interference and what we call a subluxation when those bones misalign. And the picture that's farthest to the left in this diagram is a normal neck. And you can see this curve that's going to the left, that's a normal curve. You're supposed to have a curve to the front of your body. And you look at that picture right below it, it almost looks like there's an egg sitting in the middle of the spinal canal there. That's the spinal cord. And that is a normal picture of a normal cord. It's supposed to be shaped like an egg. But if you go right over to the right, you can actually see what happens to the spinal cord when you lose that curve. And Dr. Derek, I would say, what, 80? Over probably 90% of the people that are having these types of symptoms have something like this going on?
Oh, absolutely.
And it's epidemic proportions, right?
Oh, yes. The thing is no one was ever educated on the importance of taking care of the nervous system like we are at a young age of taking care of your teeth. Like, hygiene, of taking care of yourself. No one has ever taught anybody that the nervous system needs to be maintained properly. Right. And that's what we've been doing. And so now that people start to realize how important it is, they're starting to take responsibility for their nervous system now.
Right, right. And, you know, I mean, just even looking at this other diagram that we brought here with us today, you know, your nervous system controls everything. And, of course, the brain controls every single function in your body. I mean, your spinal cord, of course, communicates with the rest of the body. So it's, of course, encased in all bone to protect the most vital system of all, which is your nervous system. And what happens is when those misalign, if you look at the diagram here, you know, these yellow lines are actually where those nerves are going to. And depending on where you have that nerve system dysfunction, if it's in the neck, you can get dysfunctions such as headaches, sinus problems, thyroid problems. If you have subluxations in the mid-back, you have stuff like asthma, allergies, lungs start to get diseased, and even in the low back, you know, stuff like digestion, reproductive organs, and even going down even lower, you know, you get even more problems with the colon and even the large intestine. So, you know, like we were saying before, I mean, we do very specific testing in the office. Can you explain a little bit about what you do in your office in Sterling Heights?
Oh yeah, I mean, absolutely. I mean, that chart you just talked about, that's in every one of my offices. That's probably, people get the most excited about that one.
Really?
Because they can actually see where those nerves go.
Right.
They understand it, but the chart you just showed, people are amazed by that when they look at that and say, oh my God, that is me. You know, and so when we know that, when they're in there looking at that, before we come in and do our detailed exam, you know, we come in, we bring a patient in, we do a detailed history always. I mean, it's so important. Right. Then you're going to do a detailed exam. We're going to even do check the nerves. We have special machines in our office that will literally check, you know, the EMG of their nerves to see if they're damaged. Okay. And we'll do specific X-rays, you know, to make sure to see which way the spine moved out of alignment, damaging those nerves. So we literally spend, you know, a good half hour to hour with them just finding out what the cause of their problem is.
The cause, yeah.
You know, and not just covering up the symptom, but what caused your body to malfunction.
I gotcha.
And so yeah, it's very detailed on what we do to find the problem.
Yeah, that's awesome. That's awesome. Well, guys, I mean, you heard it here today. You know, the next step is calling one of the Maximize Living offices. You know, one of our main offices, my office, is right here in Shelby Township, Michigan. I'm going to give you that number right now. The number is 586-997-4086, and that is our main office in Shelby Township. We have offices in Sterling Heights, Farmington Hills, Novi, all over the state, and even all over the country. So if you know somebody, friends and family, that need to see one of our offices, all of our doctors are extremely trained and know exactly how to help all types of problems. So give us a call one more time. The next 10 callers that actually do call is actually going to receive a free exam, a consultation, and an X-ray to find out exactly if we can help you. So that number one more time is 586-997-4086, and if you receive our answering system, just leave a message. We will return the calls in the order that they are received. So again, thank you guys. Dr. Derek, thanks again. And if you guys want to come into Dr. Derek's office, give our office a call. We'll give you the number to his office. So again, thanks for joining us today, and we'll see you next month.